Hello, I'm Raymond Cross from the University of Maryland School of Medicine, and I'm here to talk to you about Zeposia. So your doctor has recommended that you start Zeposia. This is a relatively new class of therapies for patients with ulcerative colitis, and it's called an S1P modulator. So S1P receptors are present throughout the body, but importantly for patients with ulcerative colitis, it impacts how your white blood cells track from the lymph node to the gut. So I live in the Chesapeake area, so we always use a boating analogy. So for white blood cells, they need to have a signal to go to the gut where they cause inflammation. One of our therapies, Entyvio, blocks the white cells and doesn't allow them to get into the colon or the small intestine. How Zeposia works is it actually traps the white cells in the lymph nodes. So if you're thinking that this boating analogy, it doesn't ever let the boats leave the dock in the first place. This medication is also used for treatment of ulcerative colitis, and there are older versions of this therapy that are less selective. Those medications have been shown to be associated with swelling in the eyes or macular edema. So if you have a history of macular edema, diabetes, or inflammatory eye disorders, it's important that you have a baseline exam by an ophthalmologist before you start the medication. There's also some concerns about slowing of the heart rate and perhaps conduction abnormalities in the heart when you're taking this medication. That doesn't seem to be a big problem with Zeposia. In fact, the safety data seems to be quite reassuring, but because of some of the older safety signals with the older therapy, it's recommended that you obtain a baseline EKG to make sure there's no heart blocks before you start the therapy. It probably increases your risk of serious infection. I usually tell my patients that there's about a 1% risk per year of serious infection. So obviously you're going to want to be monitored regularly for any signs or symptoms of infection and receive any vaccines to prevent vaccine preventable illnesses. It purposely lowers your lymphocyte count, so your doctor will monitor your lymphocyte count regularly. If the lymphocyte count falls into a danger level, your doctor may hold your drug for a period of time and then restart it. One other potential thing to consider is that our antidepressants may interact with Zeposia. So one of the byproducts of Zeposia can be increased in patients on certain antidepressants. So there's some concern that you could have what's called a serotonergic syndrome, perhaps elevated blood pressure. The data that we've seen thus far in patients with MS and ulcerative colitis that have been on an antidepressant and Zeposia seem to be quite reassuring. However, if you have depression and you're being treated with an antidepressant and/or if you have high blood pressure, after you start this medication, it would be a good idea to regularly monitor your blood pressure to see if you're having any changes for which your blood pressure medications may need to be adjusted. So hopefully you've learned a lot about Zeposia, and hopefully you'll have a great response to this new treatment. Thank you very much.